Well, guys, it's been 2 years since I had my last episode of the Jeff Crilley Show. I used to do it at the iHeart Studios, and now I have my own studios. And so welcome back after a long hiatus. I'm so excited to do this show again, and Matt is my producer. Matt, say hi to the audience.
Hello, audience. How are you?
This is kind of cool. So a little background on Matt. Matt spent 11 years at Cumulus, producing afternoon radio show, and he helped build all the studios at Real News PR. We're so excited about it. So my first guest on my relaunch of this show is Dr. Albert Pang. Say hi, everybody.
Hello, everybody.
So why this is personal for me is he is actually my personal eye doctor, and we have known each other for now 20 years. I think when I first moved to the market,
right.
You've been my eye doctor. And my team put together a piece, just to show you how personal this is, about my own eye care and what Dr. Pang did for me. Let's roll the tape.
This amazing man who's just brilliant and really cares about, the long-term health of his patients.
For the past 2 decades, Jeff Crilley has gone to Dr. Albert Pang, an optometrist at Trinity Eye Care in Plano, for eye checkups.
He works with my wife, he works with my son, he works with my daughter. He's our family eye doctor.
Crilley recently noticed his eye vision getting worse, and that's when Dr. Pang found cataracts and mild glaucoma, 2 symptoms that otherwise left untreated could cause blindness.
I would never have even thought cataracts. I was just thinking that my vision was declining.
Lens is supposed to be crystal clear, but you can see all the cloudiness.
Getting cataracts is a common theme for folks over the age of 60, but for Crilley, that part of life hits sooner.
Nearsightedness, they tend to have glaucoma problem, cataract, and macular problem.
Dr. Pang says people who work outside in the sun are likely to get cataracts at an earlier age.
A lot of time, unfortunately, not medicine, not eye drop, but cataract can be treated by simple surgery.
Dr. Pang says it has a 95% success rate in the United States. It's a procedure Crilley is now thankful for.
To the end of their journey here on Earth, they were able to have good memory, good pictures, see their family,
10 seconds.
See their friends, wedding, birthday party, everything. Keep it in the mind without being affected by poor eyesight.
For Real News, I'm Sarah Macias.
What a great piece. Well, welcome to the show, Dr. Pang. Thank you so much for joining me.
Thank you for helping me all this year.
Trinity Eye Care. So we've known each other forever, and one of the things that's consistently impressed me about you is your dedication to excellence. You have all the latest and greatest in terms of equipment. Why are you so passionate about that?
I think just like what the clip that you have shown earlier, I think I appreciate people's the vision, because vision builds your memory. You can just imagine how much good memory that you have in your life is built on pictures. If you lost all the memory of your vision, then you have nothing. So even sometimes when music come on, you remember a movie on a certain particular scene. So vision is such a enrichment in our life. So without that, we become a nobody. We become a very sad person.
Well, and there's no HIPAA issue here because I'm your patient. I'm giving you permission to talk about my history. I was slowly losing my vision, and I remember for the last few years, the colors were off. Explain why that was.
Well, in the beginning, Jeff, you have to understand you have a very high prescription, very unusual prescription. You're probably one of the few 0.1% you have such a poor eyesight, and because of nearsightedness, your chance of glaucoma and the chance of cataract and macular degeneration go up. So every year when you come in, I always monitor all these big 3 to make sure that you're not suffering from it. And last time that you came in, the reason you have poor vision is or the color is washing out is because the crystalline lens inside, instead of crystal clear, they become hazy. Because of that, they block out some of the color spectrum, make everything wash out to have a yellow tint, and that's what we call cataract.
Well, you really saved my life. I mean, I think when you slowly are losing your vision, you don't really appreciate how much of the world you're missing. And that surgery that you recommended has been a game changer for me. I see 20/20 and even better than that. And that's because of you caring enough about me to make sure I get the right care. So I can't tell the audience enough about how passionate he is about his patients. You've had patients now for how many years? Some of them,
Yeah, some of them 25 years, 26 years, yeah.
and you're treating their children.
Yeah. Well, that's a good thing, bad thing. You realize that how old you are now. So now you're seeing the grandkid, you're seeing the kid, and then it's not a good feeling.
Well, and I've got to admit, we won't name the store, but I cheated on Dr. Peng one time in 20 years. I cheated on him. I decided to go to one of the big box stores to get my eyes done, and they messed him up. And it was just, it felt kind of like a factory type situation. And I came back and I confessed that I cheated on you, but I'll never do it again.
I totally forgive you.
So tell us about your philosophy. I mean, you've been very successful for so many years in Plano. What is your philosophy?
I think the biggest thing is listening to the patients. No one patient have same story of your last patient. Unfortunately, in the medical world, we're becoming such a hurry-up business. Patient come in a lot of time, the doctor go into the exam room thinking already have the diagnosis to the patient, knowing that, hey, this patient have this presenting this problem, I know what problem this person has. A lot of time if we get into trouble, the doctor get into trouble is because you already prejudge what the problem is. I think all this year, the number one thing I learned is listen to your patients. Listen to your mom, to the mom especially, they never wrong. So if they said the children have a problem, they have a problem. Again, if the patients come in and complaining about one thing, you just have to dig deeper and listen to the story patiently, and you'll find out surprisingly the problem is not what you think. So I think as a doctor, listening to the patient, be compassionate, try the best solution for the problem. That's the number one key thing that you need to learn.
You're almost like a medical detective, aren't you? Getting to
Right.
the bottom of their problem.
Right. So we cannot be sloppy. We have to gather every evidence to support your diagnosis. And like what you say in the beginning, we try to use instrument to just give you the pieces of data. But in the end, you got to connect the puzzle together. That's what the doctor's supposed to do. Connect the dot together, present what's the most likely diagnosis and what's the most beneficial treatment for the patient.
And what I especially appreciate about you, Dr. Peng, is that it's a one-on-one relationship. It's not like although you're very busy and have a busy waiting room, you give your patients enough time so you can get to the bottom of their situation. That's important, isn't it?
Yeah, it's so important. Again, especially nowadays, how you differentiate yourself from other practice is your patience and your time that you give to the patients. My philosophy is that I don't have to see the patient every 2 or 3 minutes, but I want to make sure that every patient leave my office happy. So they got the answer what they're looking for. They know what need to be done the next step.
And it's a family company, which is kind of cool.
Yeah.
What's it like working with your family?
Well, the good thing is you never worry about, you get fired, right?
Right,
So,
right.
Next thing is, you always, feel like, you can depend on each other, whatever good or bad, success or not, is your family decision. Again, decision make much faster. And then also, the only thing is, of course, you do nothing but talk about business all day long. So, and I think there's a downside of it. Even vacation, you really never have any vacation because you're talking about what you need to do when you go back home.
I understand. Well, both of my kids work for me, and we're a family company too. And there's something about building something together. And you're expanding. Talk about that.
Yeah, we have. We just expand to our office about twice the size of the current office now. Again, we plan to bring in another doctor come in to do primary care. And we're also expanding our service into some, what we call vision therapy and also vision rehab, helping patients with brain injury or acquired brain injury like stroke, and helping patients that have neurological problem like dizziness or any kind of nauseation because of eye. So that's our plan. So we were able to expand to help more patients, and again, to diagnose the right diagnosis, and then we're able to help them with the right treatment.
Outstanding. Well, thank you for being the first guest on the relaunch of my show. Give everybody your website.
It's www.trinityeyecare.com.
Excellent. Well, thank you so much, and we're going to have you back again.
Thank you much.
And that's been the first episode of the relaunch of the Jeff Crilley Show. We'll see you next time.